one. You're now live, Doc.
All right, hello, everybody. It's Dr. Alex Earle, and it's Hump Day with Dr. Alex Earle. And this is the time I'm going to spend with you guys to talk about plastic surgery topics, okay? So really glad to be back. I know I was out for the Thanksgiving holiday, but now it's all back to business, at least until the holidays and the new year. So today I wanted to talk about something that I think is actually very, very important. It's gonna be relatively short subject, but I think it's super important. And I keep seeing like all these photos and things on Instagram, surgeons kind of demonstrating their results and things like that. And I keep seeing like all these like super obvious and multiple incision sites for the liposuction. And the truth is that it does not have to be that way. So there is a way to do your lipo 360, liposculpture, BBL in a way that does not involve very visible or multiple incisions, okay? So today I want to talk about that. I want to talk about the way that we do it here at Pure, which is we're going to be using the least number of incisions possible in the most hidden locations possible, okay? So first of all, I'm going to go a little bit into what you don't want to see, okay? Because I've seen all sorts of things, all right? So here are my very, very crude drawings, and I hope they're kind of self-explanatory there, but we have the front here and the back. And so, some of the things that you don't want to see. All right, so first of all, you don't want to see incisions in the lower belly area that are too high. Right? You put incisions that are too high, it's going to be very, very hard to hide in your swimsuit and your underwear. So you definitely want to, avoid that. Typically, most surgeons will put one inside the belly button, and that one's okay. It's usually not seen because it's kind of tucked in the belly button there. But you don't want these kind of lower pubic incisions to be too high. You definitely want them to be kind of just below the hairline. In order to really try make them easy to hide. And a lot of times you don't need this central one here either. So all of these are way too high, way too visible. You want to try to avoid those. I've seen some surgeons, I typically do my liposuction and liposculpture front and then back. Some surgeons also do kind of side to side, and then I see them putting incisions like for some reason like out here in the flanks. That is absolutely not necessary, okay? You do not need to be putting incisions there. Those are impossible to hide. If someone was wearing like a two-piece bikini, you're going to see those incisions out there. They're not necessary, so I don't recommend those either. So you shouldn't really have any incisions out on your sides, okay? And now if we move over to the back, there's one of the typical patterns that you see out there is that you see the central one, which is okay, but then you see ones that are up here. Once again, even though they're tried to be placed kind of right at the upper end of the buttock, these incisions are going to be very difficult to hide up there. Typically, they do show in a bikini, and they're like a dead giveaway that you've had liposculpture or BBL. So you want to try to avoid those. The one that's kind of in the mid-lower back, of course, extremely visible. There's nothing really going to be able to hide that one, and it's not necessary. I do see, and sometimes I use one that's up here. Now that one's going to be right in the bra line. The key to that one is that you want to see where the patient wears their bra, and you want to place that incision right in the middle, right at the bra line level, so that it's going to be hidden by the bra or the top of the swimsuit there. Okay? I've seen all sorts of things in the back. I've seen people that put do this, it almost looks like the patient got shot up. It makes no sense. I don't know why you would be putting multiple incisions all the way throughout the back. That makes no sense whatsoever. They're not necessary. They're going to be extremely visible. So please don't go to someone that does that. Ask your surgeon about where they place the incisions and how they want to avoid incisions from being seen, okay? Another thing that you might see in the front, especially when we do ab etching, especially in men, you might see some surgeons that are putting the incisions all along the area where you're doing the six-pack, okay? Once again, dead giveaway. You don't want that, all right? That's going to be an obvious dead giveaway that you had a HD liposuction, you know, abdominal etching, and they're very, very visible. They're right in the middle of the belly there, okay? So you definitely want to avoid those as well. So those are all the ones that you want to avoid. So basically you want to avoid any incisions that are going to be in areas that are easily seen, okay? And the good news is that if you go to a surgeon who has a lot of experience doing these procedures, okay, they're able to use less incisions and they're able to put them in places that are very, very well hidden, okay? So for example, if you're doing kind of your straight up liposculpture, lipo-BBL in the front, typically you're going to put, in the way we do it here, you're just going to need 2 incisions way down low in the suprapubic area, below the hairline, okay, and relatively close together, so you don't want them to be too wide out here, all right, so that even if you wear a tiny, you know, a little tiny bikini, all right, they're going to be hidden underneath there, okay? So you're going to put 2 incisions down here. You are going to use the one in the belly button. That's pretty standard, and it's tucked inside the belly button. No one's going to see that, all right? And if, for whatever reason, you have a patient that's very, very tall, okay, or that has quite a significant amount of fat underneath here, then you can then put little incisions right in that inframammary crease, all right? So in that crease just below the breast, so it's going to be hidden underneath the breast there. You know, as you're standing, no one's going to be able to see that. So you can hide them underneath the breast, and that's how you can tackle some of these areas here, all the way out here if the patient has a lot of excess fat there. And if you're doing the ab etching in a woman, that's where you want to put them. So you want to put those incisions in the inframammary fold, and from there, if you use specialized curved cannulas, you can do the ab etching from there and even create the 6-pack, okay, through those incisions without having to have all the incisions in the middle of the abdomen, okay? So that's a very, very versatile incision there, very easy to hide, okay? So that I recommend. If you're gonna go then to the back, once again, for most patients, you really don't need multiple incisions. You can really do most of the work with just 2 incisions. That's all you need. This one is going to be well hidden in between the butt cheeks there, in the upper part of the butt cheeks. So even if you wear a little tiny bikini, completely hidden in that area. And then the one that's going to be right at the bra line. The key to that one, once again, is to kind of see where the patient wears their bra and to make sure that you're putting it right at the bra line there. So it's going to be hidden even if they're, you know, with their 2-piece bathing suit. Now, there are some patients where they don't even want that one, right? You want to avoid that one. They want to avoid anything in the back altogether, and we can do that too. The key to that is to hide the incisions inside the armpit. So you can go up here and put the incision just inside the armpit in the natural crease there, such that it's not going to be noticed or seen. And from there, you can then reach the back, okay, in all these directions, and reach the mid to upper back as well. So I actually personally like that incision a lot. But there are some caveats to that incision, because I've seen people try these incisions and they don't really measure out exactly where that crease is, and so the incision ends up being something like up here or up here or here or here, and then once again ends up being very, very visible. So you want to try to avoid that. You want to look at the natural crease of the patient. So every patient's going to be a little bit different, so not every patient's going to be in the exact same location. But you want to find those natural creases, and you want to make your incision inside that natural crease right there, okay? And then I haven't drawn it out here, but the other one is the arm. So if you're adding arm lipo, once again, you can make the incisions very, very hidden by hiding it in the natural creases. We all, of course, have our elbows, and the skin of the elbow tends to be kind of a little bit more loose and have all these little creases within it. So you want to place that incision right inside that loose skin area of the elbow, and that's going to make it very, very well hidden. And if you have to do some work in the upper arm, especially when you're doing, say, etching or fat transfer for men, once again, you're going to hide it in that crease, but now on the front side. So you're going to hide it in that armpit crease, but in the front, which is going to be somewhere kind of right into here and here, okay? And you can hide that there. From there, you can go to the arm and you can do the biceps and create the definition there as well, okay? But the point is, you don't want to be seeing incisions everywhere, okay? Nowadays, yes, plastic surgery obviously is a lot more accepted, which is awesome. That's great. Okay, but you don't want, like obvious signs that you've had your liposculpture, your HD lipo, or your BBL. So, talk to your surgeon about the incisions, talk about where they're being placed, how many are going to be placed, and where they're going to be to make sure that they're all in these very, very nicely hidden locations. Okay, and really all it takes is experience and some specialized cannulas, right? You need some longer cannulas sometimes to really reach all the areas you want to reach, and you need curved cannulas to, especially if you're doing the high definition lipo and the ab etching, you need curved cannulas to be able to create these lines from the remote locations. Okay? All right. Questions?
First, a comment.
Yes.
You are my favorito.
All right. Muchas gracias.
Be patient. Can you do lipo on upper back or bra fat area with a tummy tuck? Also with the flanks?
So it depends on, so the short answer is potentially yes, okay, but it depends on the patient and really how much fat they have to remove, all right? So because here in the state of Florida, we are limited to only removing 1,000 cc's of fat via liposuction when you're doing a tummy tuck, okay? So if you're a patient that's a little bit on the bigger side and you already have 1,000 cc's in the flank and in the waist area, then we really don't have enough, any room to go to then, address the back or some other area, all right? But say you're perhaps on the thinner side, you don't have 1,000 cc's in there and we have some room to give, then sometimes we can go up and do kind of the lateral breast or the bra line area or add some other area as well.
Okay, see you in January.
All right, yes, January's coming up. It's going to come up quick. I mean, the holidays are right around the corner, but definitely looking forward to it.
Okay, why does J plasma and ab etching hurt more during recovery rather than the not getting it?
Well, sometimes the ab etching can potentially hurt a bit more, just because you're being more aggressive in the areas that need to be essentially etched out, right? The lines that you're forming, the valleys that you're forming, you're being a little bit more aggressive through there. So in order to kind of create these lines, right? So in order to create the lines, if you, especially say you're doing a six pack there, you have to be more aggressive in those areas to really kind of thin it out, and perhaps that can create a little bit more, a little bit more tenderness, a little bit more pain. The J plasma or the body tight, the forms that we use for skin tightening or even the Vaser, those really shouldn't add any additional pain. That doesn't really add any more pain. But sometimes the ab etching potentially can. What I'll tell you though is that for any form of liposculpture, HD or anything else, you may have some pain. It's more intense in the first 24 to maybe 48 hours, and then it drops off quite quickly after that. So you really kind of have to push through, power through a little bit the first 24 to 48 hours, and after that you're going to be feeling much, much better. And most patients stop their narcotics or their Percocet after 48 hours and switch to straight up ibuprofen or Tylenol.
What's the BMI requirement for an extended tummy tuck?
So for me, my max BMI is 30, okay? For Dr. Vidal, Dr. Wigriff, I believe it's 33.5, so a little bit higher there, but it's gonna depend on the surgeon. But for me, max BMI would be 30.
Doc, I had a tummy tuck procedure with you, and
Yes.
I just had a baby. Can you do a mini tummy tuck, or needs to be whole tummy tuck again?
All right, so it's a good question. It's really going to depend on your evaluation. So I would have to kind of, see you or see your photos and your videos again to determine what's going to be the best course of action, okay? If, your muscles were kind of able to bounce back after the last pregnancy and you don't have a lot of muscle separation or you don't have a lot of weakness of the muscles, then sometimes, a mini tummy tuck would do okay. But remember this, the mini tummy tuck is only going to address any loose skin that is below the belly button, okay? It does not address any loose skin above the belly button, and it does not address the muscle separation or weakness, okay? So if you are a candidate, that means that all you have is just a little bit of loose skin in that lower belly, and then those patients are okay with the mini tummy tuck.
I want to get Lipo 360. But I live in New York. How long do I have to stay in Miami?
Great. So that's a great question, and most of our patients actually come from out of town, from other states. Actually, New York is a very, very big one. New Jersey, but of course we get patients from everywhere, as far out as California, even Alaska, right? So I think I don't know. We've had all 50 states, but we must be pretty close by now.
And we have a hotel.
Yes, that's right. And we get patients international as well. We've had patients recently from Ghana come all the way here from Ghana, which has been actually awesome. Very, very, it's inspiring to see people travel all this way for the procedure. So the short answer is you have to be here for a minimum of 5 days after surgery. Then of course you have surgery day, and then you have your pre-op, which is before surgery. So typically most patients that visit us from out of town are going to be here for at least a week.
How important are lymphatic massage? Is it evidence-based or experience?
It's both, and it's extremely important. And if you talk to any of the very experienced, liposuction surgeons, not just in the US, but throughout the world, they're all going to say that the post-lipo lymphatic massages are extremely important for optimizing your results, okay? And I agree with them, and based on the literature and based on my experience. And so I recommend an absolute minimum of 20 massages after surgery in order to truly optimize your results. And when I say minimum, that means I truly mean that. You're not going to be doing any less than 20, but potentially you could be doing more. There are some patients that have done 25 or 30, okay, but no less than 20 post-lipo lymphatic massages. I'm talking about, this is for all my lipo 360 and BBL cases.
Okay. How much healing time would you need after a BBL?
Healing time? Yeah, so, obviously you're gonna need time to recover, right? When you ask healing time, it really depends on exactly what you're asking, but say, a lot of people ask, Doc, when can I get back to work? I work in an office type setting. So for an office type setting, most patients are back to work as soon as 7 days, probably average somewhere around 10 days after surgery. And you're typically back to driving around that time as well. Now, if you have a job that requires more of a physical activity, so more like strenuous activity and lifting, then it's going to take 6 weeks before you get back to a job like that. You certainly won't be able to get back to the gym, lifting any weights or doing any swimming until 6 weeks after surgery.
How soon after surgery should you start massages?
So, if we're talking about this surgery, right, lipo 360 or BBL, you're going to start as soon as the next day. That's right, there's really no breaks here. So next day, you're going to get your first massage. You're going to be looking at your skin. You're going to make sure everything's doing okay. After that first massage, that's when you're going to jump into your faja for the first time. All right, and then you're going to continue these massages daily up till you get to about somewhere around 7 massages. Once you get to 7 massages, then you can spread them out a little bit more. You can start going every other day for the next 7 massages or so. And then eventually you're going to come down to like 1 massage a week until you get to your 20 or 21 or however massages you need.
Ok, si le puedes explicar en español cómo hacer una consulta.
¿Cómo hacer una consulta?
Aquí en TikTok.
Sí, buenas, ok. Hola mi gente en TikTok, y sí, es verdad, aquí hablamos español también, si tienen preguntas en español, por favor, las pueden mandar y se las vamos a contestar. La manera más fácil de hacer una consulta con nosotros es ir a nuestro website, a nuestro sitio web, ok, que es www.pureplasticsurgery.com. Déjame escribirlo aquí, lo voy a escribir acá abajo. Ok, www.pureplasticsurgery.com. Ok, ahí van a ver un botón que dice Virtual Consult. Ok, y le van a dar a ese window, ese botón, y ahí le va a llevar un cuestionario y van a llenar su información. Van a mandar unas fotos y cuando manden todo eso, les va a llegar a una de nuestras coordinadoras, Las coordinadoras son todas bilingües, así que no se preocupen, hablan inglés y español. All our coordinators are bilingual, they speak English and Spanish, ¿ok? Y la coordinadora las va a llamar y ahí pueden repasar toda la información, le va a dar mucha información, ¿ok? Le va a dar todos los detalles en términos de precios, etcétera, etcétera, y las van a guiar en los próximos pasos para agendar la cirugía, o si después quieren una consulta en persona, etcétera, etcétera, las coordinadoras les ayuden con todo eso. Okay.
Okay. Do you offer Exparel? Can you explain about it?
Yeah, definitely. So I think Exparel is great. Okay, and I would, if I were a patient, I would never do a tummy tuck without it, right? So what is Exparel? Exparel is an injection that we use at the time of the tummy tuck, and we inject it along the muscle repair and also along the incision, and it's a numbing medication. It basically provides pain control for the first 72 hours. So it works really, really well. It makes a tummy tuck a lot more easy to tolerate. And I definitely would recommend it for any of our patients getting a tummy tuck, whether they're getting a tummy tuck on their own or with a mommy makeover, okay? A lot of patients will do the Exparel, and they may not even need the Percocet, or maybe just take the Percocet like the first day and then switch over just to straight Tylenol. So I do highly recommend it.
Okay. When does the fat truly take hold once transferred? Is it 3 months or more?
So I believe the fat, really takes at the time of 6 weeks, okay? However, at that time, even though the fat cells that were going to survive have survived, they've gone through a suffering phase, if you will, okay? So they've survived and they're alive, but they're not thriving just yet, all right? And so that's why the 6 weeks tends to be a low point, because you've lost some of the fat, and then the fat cells that have survived are they're kind of shriveled up a bit. They're a little bit dehydrated, if you will. And so then those fat cells then have to start to thrive, they have to plump up. And so that's why, even though I believe, the fat cells that have survived 6 weeks, and you can start doing your sitting at 6 weeks, I recommend that you continue to feed the fat for the first 3 months, okay? So when we say feed the fat, which means to increase the healthy fats in your diet, you want to do that for the first 3 months. So don't quit at 6 weeks. You need to continue to feed the fat for the first 3 months. And it's extremely important that you don't lose any weight whatsoever in those first 3 months, because that's just going to cause, that's just going to make you not be able to get into that fluff phase. And so things are going to become smaller than they could be otherwise.
Are you able to reduce lats created by a previous surgeon?
Yeah, so that's actually a great question. So we've been seeing more and more of that lately. Sometimes we call it BBL reductions. Sometimes we call it basically like a BBL reshaping. There can be different terms for this, okay? But the point is that back a few years ago, more kind of like vixen looks and more like surgical or more fake looks were in. And so you're seeing like a lot of shelves and a lot of lats, okay? And nowadays, people are not really wanting that so much anymore. So they want a more of an enhanced natural look. So they're looking to create a new shape. They're looking to remove the shelf, remove the lats, and sometimes even looking to just decrease the volume of the hips and or the buttock overall, okay? And that's certainly something that can be done. And so we've been getting quite a few calls about that. We're actually becoming kind of an expert center for that, because not a lot of people do it, because these can be challenging cases. So we definitely do it. We take it on a case-by-case basis. So for sure, go to our website, go to that virtual consult form so you can send in your information, your photos. That way I can take a look at everything, do an evaluation, and make sure that I believe that we can help you, we can reshape things, we can reduce things, and get you to a point where you'll be happy.
Okay. Will I be doing a lymphatic drainage massage the same day of surgery?
Not the same day, but you're going to be starting the next day. All right, so if today was surgery, tomorrow you get your first massage. All right. The other thing you should know, this is something that I've changed. So for some of you that have been following me for a long, long time, this is a recent change, okay? But I decided that it's better to not be in your faja that first night. So whereas before we would put your faja on as you were waking up from surgery, we're not doing that anymore. So you're gonna go home and you're gonna spend the first night out of your faja. Then the next day we're gonna be evaluating the skin. We're gonna make sure that everything looks good. Then you're gonna be able to get your first massage. And once you're done with that, that's when you're gonna get into the faja for the first time.
When can you start scar treatments for a tummy tuck scar?
So we're gonna start working on the scar as soon as 2 weeks post-op, okay? So initially you're gonna have those skin tapes or steri-strips are gonna be covering the incision, and at 2 weeks you can remove them. It's easiest at that point in time when they're wet in the shower. You're gonna go ahead and remove those steri-strips, and then you're gonna start using a scar cream. The one that we recommend here is called Silogen. So it's a silicone-based scar cream. It works really, really well. You're gonna start putting that over the scars twice a day, every single day, for at least the first 3 months.
Belly button shapes after tummy tuck.
Oh, yes. All right, so each surgeon has their own style, right? And so they might have a different shape that they like or they're used to. There are some belly buttons that end up being a bit more round. There's some that end up being more like a slit, and some that end up being like super little tiny like pinholes. Okay. Me personally, I like the one that's just a little bit more round. You know, a nice size, not too small, like not a pinhole shape. Obviously, not too large. And I try very, very hard to keep that incision as tucked in as possible. Okay, because really a tummy tuck is all about the belly button, okay? If you can create a beautiful belly button, typically the patient is extremely happy. And if the belly button looks more kind of like, it looks more fake, it looks like a slit, or if unfortunately the scar became like hypertrophic or keloid, then the patient is less happy, okay? So there's a few things that we try to do here to try to make that belly button as natural looking as possible. So one is that, yes, we keep your belly button, we don't move it in terms of its location, and then we have to, and then I try to like tuck that incision in as best as I can. It's easier when there's a little bit of fat around the belly button. If you get a patient that's like super thin, it's obviously harder to tuck it in. So there are some limitations there as to what we can do, but the whole point is to try to tuck it in as best as we can so that that incision ends up more on the inside and it's not visible. Or at least less visible from the outside.
Do you need to wait until your drain incisions heal before using the silicone scar gel?
Not necessarily, because you can use the gel over all the other parts that have healed, right? But yes, if you've done your tummy tuck and you have your drains were in, say, for like, I don't know, 10 days, right? And then you remove the drains, it's going to be a little opening there. It's going to take a couple days for that to close and to seal. So just avoid those areas while they're closing, all right? But you can use the Silogen over everything else. And then once those areas have closed up, then you can start using the Silogen there as well.
Are seromas very common post-surgery? Because I'm worried getting one. Should I extend my stay longer than a week for post-massages?
So seromas are probably the most common thing that could potentially happen after surgery. That's the bad news. The good news is that they're really not a big deal, right? Typically, you just put a needle in, you drain it, you may drain it once or twice, and then it's gone, okay? Seromas for Lipo360 and BBL actually are less common. They're not that common, especially if you're doing the right thing, which means you're wearing your compression adequately and you're getting your massages, right? So if you get your massages and you're wearing your compression, the chance of seroma should be much less, all right? Similarly with the tummy tuck. With the tummy tuck, what's decreasing the chance of seroma is the drains, right? So you don't want to remove the drains too soon. If you remove the drains too soon, the risk of seroma goes up. Okay, so that's why we want to wait and really make sure that it's less than 25 cc's in 24 hours before we remove that drain. And so it is quite possible that you may end up going home with a drain. And it's okay. You can leave at post-op day 5. We'll leave with a drain. We'll keep following you along. And when it's time to get the drain out, we're going to help you through that as well. So don't worry about that too much. But the key is that it's much easier to leave a drain in for a day or two more to make sure that there's not a lot of fluid coming out. It's much easier to do that than to remove a drain too early and then you develop a seroma, and especially for out-of-town patients, then they got to look for someone that's going to be able to drain that seroma, which can sometimes be a little bit painful. Okay, so key factors? Takeaway: you want to decrease the chance of seroma. you're doing Lipo 360 BBL, make sure you're wearing your adequate compression and you're getting your post-lymphatic massages, okay? You had a tummy tuck and you want to decrease the risk of seroma, make sure you're not removing those drains too quickly. All right? Okay, awesome. Well, I hope this was very, very informative. Again, the incisions, they should be very, the least amount of incisions as possible and in well-fitted locations. So make sure you bring that up with your surgeon. A surgeon that has a lot of experience with specialized cannulas will be able to do this without having all these visible incisions all over the place. All right? Okay, well that's going to be it for today, but I look forward to catching up with you all next Hump Day with Dr. Alex Earle. We'll see you on Wednesday. Ciao.